Now that we've taken a look at our body systems, we need to know how we might monitor those to make sure that they are functioning properly. There's a bunch of different medical technologies that we can use. This isn't an extensive or exhaustive list, of course. There are tons more. So a CAT, or CT scan, is an X-ray of the body to check for swelling or internal bleeding. It's better than an X-ray because it can focus on specific structures, aka you don't see them all at once like you would in an X-ray, and it has better resolution and can change the viewing plane. So you're looking at a chest CT here. These are the lungs. Whereas you're looking at an X-ray here, and these are the lungs. So we can see the spine, the rib cage here. Basically, we just get a different, like a cross section of our chest versus looking straight through it. And we don't see all the other structures like our ribs here. You can also see, of course, it's much clearer image. An X-ray typically is used to show bone structure and identify breaks. X-rays can go through skin and muscles, but not dense structures like bones, so that's why they come out as white. An EKG diagnoses disorders of the heart. So it provides a graph of electrical pulses that pump our blood in our heart. So basically the electrical pulse is the contraction of a chamber in our heart. We can diagnose heart rate, the strength, the size, and the position of heart chambers using an EKG. An EEG measures the electrical impulses just like an EKG would, but now they're measuring them in the brain. So they put these electrodes all over somebody's scalp, and each one will pump out an electrical impulse reading as well from the nerve impulses in our brain. An endoscope is a long tube that has a camera and a light on it, and it's put down our esophagus to look at the upper digestive system, so the stomach, to diagnose ulcers and other types of stomach problems. A blood pressure cuff, or sphygmomanometer, big word, is used to check blood pressure. A stethoscope is used at the same time to check heart rate. So our typical blood cuff is all I would reference it as. I'm not going to use this word again. So how do we measure blood pressure? So 120/90 is a common blood pressure you might hear, or 120/80. 120, that first number, is called the systolic pressure. It is the force your heart exerts on the walls of your arteries each time it pumps. It's like the highest pressure that your heart is exerting, okay? The most forceful moment of pumping your blood. 90 is what we call the diastolic pressure, so the second number reported here. It measures the force your heart exerts on the walls of your arteries in between beats. So when it isn't forcing the blood through, what is the lowest pressure that your heart experiences? So it's kind of like that rest moment. How much pressure is your blood under at that point? Blood pressure versus pulse. So blood pressure is the pressure within your body. Low blood pressure could be something to look at, that you might be losing blood. If it isn't something that they can see that you're losing blood externally, perhaps you're bleeding internally. So blood pressure can give really good indications of what's going on inside. It can be an indication of an infection or dehydration, a bunch of other things as well. High blood pressure could be an indication of a chronic condition like heart disease, or that somebody is at risk of a stroke or a heart attack, or they've got clogged arteries. There's so many different things that high blood pressure can be an indicator of. These can also be affected by medications that people take. So your blood pressure can be affected by different medications. And so it's really important if you're having your blood pressure taken and it's used to diagnose something that you let somebody know if you are on any medications, because it could explain different results. Okay, that's what blood pressure is all about. Pulse is a measure of how many times a minute your heart beats. So often, if you have a low blood pressure, you might have a high pulse because your body is working overtime to try and pump as much blood around as possible, even if it had a low pressure. There's some practice on page 193 of your textbook for you, number 1 and 2.